Hi, welcome to CR Arthritis at the Canadian Rheumatology Association and Arthritis Health Professionals Annual Scientific Meeting. My name is Eileen Davidson. I'm a member of the Arthritis Research Canada Patient Advisory Board, a writer for Creaky Joints, and blog Chronic Eileen. It's my pleasure today to be here interviewing Dr. Jason Kerr. He is a member of the clinical staff of Vancouver General Hospital and a clinical assistant professor at the University of British Columbia, teaching junior doctors and medical students. His practice interests include psoriatic arthritis, ankylosing spondylitis, spondyloarthritis, osteoporosis, and gout. He also travels frequently to care for outreach patients in Terrace, BC. Dr. Kerr is a fellow of the Royal College of Physicians and Surgeons of Canada and a diplomat of the American Board of Internal Medicine. So he has a very long title. Welcome. Now,
Thanks.
can you tell us a little bit about your role in rheumatology?
I've been a rheumatologist now for almost 15 years. I did my med school in Alberta, and then I came to Vancouver for residency and fellowship. I have a busy clinical practice in Vancouver, but I've done outreach clinics in northern BC as well as Whistler. For the past 10 years, I've been the president of our section of rheumatology, our BC Society of Rheumatologists. So I've been interested in models of care and how we better can use nurses and other healthcare members in delivering care to our patients who come from such different parts of the province.
To ask a question about that, what can a nurse offer at a rheumatology office?
Oh my goodness, nurses have become invaluable for us over the past decade. So we've created a model here in BC where nurses help so much with education and teaching. We have a lot of drugs that are given by injections, and there's special monitoring for them. So in the old days, we used to ask family doctors to do this type of work, to do injection teaching and do vaccinations and all those sorts of things. But now we can do them in-house with our own nurses and make sure that our patients get the best quality care. So it's really making that model more patient-centered, so that patients, again, don't have to go to 5 different locations to get the things that they need done.
That's really interesting. Now, can you tell us about any research updates in your field of care?
Yeah, so if we look at the area of spondyloarthropathies, I think we have seen some big advancements with the options of treatments available for patients. So previously, we used to have just one class of medication, the anti-TNF drugs, that we could use for spondyloarthropathies. But over the past couple of years, we have new targets and new options for treating the back inflammation. And what this means is that much like rheumatoid arthritis, we have more options for patients, and we can tailor the treatment options better to the patient in terms of what's going to work for them. Whether injections work better, or oral agents, or a different mechanism if they've failed a previous treatment. So that's been really exciting because, again, rheumatoid arthritis has had a lot of new treatments, and now that we're seeing that trickle-down effect for some of our other conditions that we treat.
That's really good to see.
And similarly, if we look at osteoporosis, we've also seen new mechanisms and targets to treat bone loss. So osteoporosis, again, didn't have much that we could use until recently, and we have a lot more options for people that have complicated bone loss.
Oh, now what about those who might be unfamiliar with what gout is? Could you tell us a little bit about what gout is and what are some of the common symptoms or causes?
Sure. Yeah, gout is actually the most common inflammatory arthritis, and it's related to your metabolism. And in some people, they accumulate too much uric acid, and that uric acid then precipitates in a joint. And when that happens, it causes this tremendous inflammatory response. Usually, it happens in a big toe first. That's one of the most common joints. And it's people say it's the most painful arthritis there is. And these flares can last anywhere from a few days to a few weeks. And as I mentioned, it's related to this uric acid buildup. So our treatments are aimed at trying to lower that in people's system so that it doesn't accumulate as much. And it's not just the joints, though. Gout can cause other things like kidney stones and funny nodules on people's skin. So it is a very kind of profound inflammatory condition.
Hmm. Now, can you explain the difference between osteoarthritis and osteoporosis? And are the treatment options the same?
So we get this all the time, I think because the word sounds so familiar. Um, Osteoarthritis is the most common type of arthritis out there, and most people refer to that as a degenerative arthritis. So over time, usually as we get older, cartilage starts shrinking, and when that happens, you eventually can get bone-on-bone degeneration in people's joints. And that leads to a lot of pain, swelling, and stiffness. And that can pretty much happen anywhere, but it's the most common reason why someone might get a joint replaced for, say, their hip or their knees. And that's the type of the degenerative arthritis that osteoarthritis is. Now, on the flip side, osteoporosis is completely different. So osteoporosis, most people don't even know they have. Uh, uh, you don't know you have osteoporosis usually until you break a bone, or you have a bone density that tells you that your bones are weak. So the osteoporosis is more about the quality of your bone and the risk factors for breaking. So the treatments for osteoarthritis have a lot to do with strengthening, good physiotherapy, protecting the joint, and muscle building. And the treatments for osteoporosis are focused on bone health. So calcium, vitamin D, balance work, and then some of our drug treatments for osteoporosis. So very, very different entities. Now they are more common as we get older, both of them. So that's also why people can definitely have both, right? Osteoporosis and osteoarthritis.
Is osteoporosis more common in women?
Absolutely, yeah. It is a bit more common in women. Bone mass is a bit different in women, and there are hormonal differences that sort of predispose women to getting thinner bones as they get older. Women also tend to live a bit longer too, so there's that propensity to have lower bone mass as women age as well.
Are there any preventative measures that women can take?
Absolutely. So we know that strengthening and activity is super important for preventing bone loss. People that are more sedentary get more bone loss than those that are active, especially as they age. And then making sure you're getting adequate calcium in your diet, as well as taking vitamin D, are really, really important at prevention.
Now, I imagine as a traveling rheumatologist, the pandemic has made your job a little bit more difficult when it comes to travel. Has it affected you at all with caring for your patients? And what have you learned from this experience?
Oh gosh, people are going to be writing about this for years to come. Rheumatologists have been really quick to adapt to new technologies so that we can offer our care in a different manner. And what that's meant, I think, we've been quick to use telephone, video, and what in-person visits we could offer. But what that's meant is it's actually made it, I think, a bit easier for our remote patients to contact their caregivers, because there isn't this barrier of waiting for a visit or someone to come to the community. And it's kind of made it like the great equalizer, so that people in all parts of the province have a more similar access to contacting and connecting with their care providers. So in a sense, I think that's been one thing that's been good. Obviously, nothing totally replaces an in-person visit, especially when we're trying to examine joints. But we've been really creative over the past year at finding new ways of contacting patients, and again, using video, doing examination on video. And sometimes that makes it a little bit more complicated or more visits for the patient, but it saves them the travel, the time in traffic, the parking, all those other things. And I think the challenge for the future is going to be determining which services are going to be best suited to do remotely and which things we need to bring people in person for, and finding that balance. I think that's going to be exciting though, because this really has been an opportunity to change healthcare and sort of strengthen our public delivery of healthcare.
Yes, I've written a couple articles myself on it for Helpline and Creaky Joints about how virtual health has really transformed my care. I particularly really like as a rheumatoid arthritis patient that it has saved me so much energy to be able to manage my disease better. And that's really important when you have to precisely come up with your routines of self-management when living with these conditions. Now, for the last question I have for you, you're a rheumatologist, you see thousands of patients. What are your favorite self-management and pain management tips to give patients?
Yeah, I always go back to basics. So for me, that starts with activity and exercise. And I know that's been really tough with the pandemic, but activity is medicine, it is treatment. And so finding ways to do small activities on a regular basis, can be as powerful as medication in some cases. So, and getting outside into nature and doing those paced activities is super important. The other thing that I'd say then is sleep. So again, another thing that has been really negatively affected by the pandemic has been people's sleep cycles. There's been a lot more anxiety and people just not doing the things they normally do. And we know that non-restorative sleep or poor sleep increases pain levels regardless of the type of arthritis that you're suffering from. So working on sleep hygiene and trying to getting better quality of sleep will lead to better pain control over the long run. It's one of those things, it's a tough one to work on, but it is so important for our patients. And
How
then
can
last,
patients, oh, sorry, how can patients address the sleep issues?
oh, it's tough. So there's different things you can do. So there's whole areas written about sleep hygiene and things like making sure you go to bed at the same time and limiting things like alcohol and caffeine consumption, at certain times of the day, and getting that routine going, and a dark room and all those sorts of things, and not having mobile devices and TVs around at nighttime. All of those things can try and help improve your quality of sleep. And then there are, there's help with natural products for sleep, and then we even have prescription products if it's really bad. So there are lots of different ways that we can try and help patients with their sleep. Although it's a tough one because it's all those things. It's not just one thing, right?
Mhm. It just
Uh,
takes a question to your rheumatologist to ask. Indeed.
yeah. And
And
the
you were
last
going
thing,
to go.
yeah, the
Yes.
last thing I'd say is being part of your community, right? Again, another thing that suffered during the pandemic is we're not as connected as we are with people, and being part of your community and getting involved in things can definitely help people have help with their mental well-being and improve quality of life, and not feel so socially isolated, because those things do lead to more pain and disability.
Do you have some tips of how arthritis patients can communicate with their community? Any ways they can participate in research or any other organizations where they can connect with other patients?
Oh, we have so many great ones in this province, which is great. But the Arthritis Research Canada has been super helpful. We've had patient partners in the past. There's lots of great ways that people can get involved. The Arthritis Society has so many links and resources as well. So we encourage people to get out there and get involved. And hopefully one day we'll be able to do things like our walk for arthritis again, and get the community together.
Excellent. Well, thank you so much